I'm Dr. Constantinides, and I work here at Westlake Dermatology in Lamar Central. And today I'm going to try to cover what I think is important about the latest way of doing facelifts, which is the preservation deep plane facelift technique. It's pretty much the only one I use because of how amazing the results are, and longevity is incredible. We can we can expect transformative results with a preservation deep plane facelift. This woman had a deep plane facelift, endoscopic brow lift, blepharoplasty, and a chemical peel around her eyes. And I think we can all agree that this just looks like her, but about 20 years earlier. And although we can't really say that facelifting causes a improved, sort of aging, I don't really like to think that things are aging, but but we hope to say that hopefully that facelifts can create incredible improvements. Now, the deep plane facelift has some unique characteristics, and we're going to go through some of those things and how it differs from other facelift techniques. But just a little bit of housekeeping. On this call is also Devin Wright. Devin is our cosmetic consultant. And Devin will be organizing our Q&A. If you notice in the top part of the strip, or however you oriented, there's a Q&A button you can press. And if you have any questions that come up during my presentation, please write them down there. And at the end of the presentation, I'll try to answer all of the questions that are pertinent. We'll also go through sort of the logistics of getting further information about the surgery and that sort of thing at the end. So for now, let's carry on a little bit. Next slide is sort of a little bit about me and where I've been and how I got here to Austin. After Brown and Columbia undergrad and medical schools, I did my residency in New York at NYU. In the Department of Otolaryngology. And then I did a fellowship in facial plastic surgery. Went back to the NYU Department of Otolaryngology as director of facial plastic surgery, where I was in charge of teaching and research and publishing, and traveled to a lot of presentations. And that was for 20 years, from 1994 to 2015. I strongly believe that sort of teaching is the best way to be a better learner, and most of my career was based on trying to further the field of facial plastic surgery. I'm a strong proponent of that. During the process of my sort of education, I was double board certified in otolaryngology, which is ear, nose, and throat surgery, and facial plastic and reconstructive surgery. Then in 2015, I decided to make a lifestyle move out of New York after 20 years and joined Westlake Dermatology. I've been here for 10 years and really trying to push the envelope on what is the best way of doing things in all the things that we do here as facial plastic surgeons. And so when I got here, I also am very proud to say that I was the founding president of the South Texas Society for Facial Plastic Surgeons. And that's been a great resource for all the young people that have moved into the area to sort of get additional mentoring and help, and just a forum to discuss problems. So let's talk first about, so as an educator at heart, I'll try to educate y'all. And so what happens as we get older? Well, obviously the skin changes, but then the underlying structural support of the face changes. Brows can descend, causing heaviness around the eyes. The upper eyelid skin can actually become redundant or extra and cause additional heaviness. And we see all these features in this patient where her eyebrows have descended, causing heaviness left greater than right for her, extra skin as well. And then the lower eyelids, the fat can come forward. It's held back by a wall of ligaments in youth called the orbital septum. And that wall of ligaments inserts here, creating this depression or tear trough. And so the fat from the eyelid can bulge forward, but can't really go beyond that. But the fat in the midface, the deep fat in the midface and cheek area descends away from that area, creating further gullying. And so this transition is a real hallmark of aging around the eyes. But midface volume loss, bony loss, and descent is something that we really can address beautifully with a deep plane facelift. Heaviness, deeper folds around the mouth, these heavy lines in the marionette area at the corners of the mouth, and then structural loss of the SMAS layer, which is the layer that when you pull on your face, you kind of see and feel. That structural loss can improve with surgery to try to free it up and move it. And then we get this neck laxity as well. So she has hallmarks of aging throughout every area. What happens with this is sort of a cross section of the anatomy of the area and what we see: skin, tissue, subcutaneous fat. So this layer of fat and fibrous tissue is one of the layers that we lose as we lose weight. So now with GLP-1 agonists like Ozempic, we lose fat in this layer. But we also lose fat in this musculoaponeurotic layer, which is called the SMAS, this layer that when we move the face forward, upwards in a way that we sort of like to see, that's the layer we're moving. We're sliding that layer across the deeper layers in the face. However, that layer doesn't slide easily because there are these retaining ligaments that connect it to the deeper structures. So with deep plane facelifting, our goal is to release these retaining ligaments and lift this outer structure as a unit to try to move it back to where it was 15, 20 years ago. And so the traditional older school facelift technique, the SMAS lift, separated the skin and SMAS layer and pulled on this SMAS layer backwards. But there wasn't any significant release of these retaining ligaments. Without that release, there's only so much mobility, so much improvement that could be obtained of the SMAS. And then in the mid-face area, without release, we don't get any improvement. So the SMAS lifts failed they could give a reasonable jawline for a period of time, but because we're not unsticking or moving that layer, that improvement is short-lived. And then the deep plane lift, on the other hand, separates the retaining ligament layer. And so we're not on top of the SMAS, we're underneath the SMAS, separating it and moving it. And that separation and movement allows improvement without a lot of pulling. And so so when we have patients with weight loss, we lose the thickness of these layers that we're lifting, and we'll see some of that in my examples of patient cases a little bit later. But in weight loss patients, we also see deep fat that's deeper to these areas on top of the bone also is lost, and that fat isn't changed or moved with any kind of facelift procedure. So this is a slide of all the various retaining ligaments. So so when we're talking about a SMAS lift, where the SMAS, the subcutaneous musculoaponeurotic system, is pulled without freeing up its undersurface, we can get improvement in the neck and jawline, but limited. So we have poor longevity, and as that lift ages, we get an unnatural pulled look because of the way that the pulling has occurred. With deep plane lifts, we're not pulling. We're releasing these retaining ligaments and moving the structure without tension so that we can move it up to where it was 15, 20 years ago and then uh, hold it there while the body heals it there. And so because we're changing the level of that tissue by 15 or 20 years, we get an improvement of a structural improvement of where that tissue is, and then you age from there. So we're not stopping aging, but we're aging starting at a very much better place. So let's go back to this young lady. A release of this entire layer all the way forward and release in the neck and moving back has improved mid-face volume. We haven't added fat here. We're moving her fat layers up to where they were when she was younger. We haven't done anything other than moving the tissue in this area around her jowl by releasing and moving it. And so look at that incredible rejuvenation that we've achieved in the mid-face area. Smile lines, as they get deeper when we get older, because the skin and SMAS layer is loose and bunching. By releasing underneath it and moving it, the deep smile lines improve, and she looks just amazing when she smiles now. Now, of course, we did her eyes, we did brow lift, we did other things to improve around the eyes, but I want to focus on what's going on in the mid-face and jawline. The laxity that she has that's causing all this laxity of her neck muscles. She doesn't have a lot of fat here. This is just looseness. It's looseness in the jowl area of the SMAS. It's descent of the malar fat pad, this fat pad in the mid-face, and descent of the volume in her face downward. Repositioning and moving it up is all she needs. To do that, we have to release it first, unstick it so it moves naturally. We're not pulling at all, so the incisions heal beautifully. There's hardly a scar visible because we're not pulling on the skin at all. We're moving the skin back to where it was 15, 20 years ago. Again, smile lines improve, jawline looks better, and she looks better. All that laxity that she has is much improved with a much softer and natural looking jawline. Another deep plane facelift. This is without anything else. And we see on front view very clearly improvement along the jawline. Her upper neck looks better. But really importantly, this transition looks beautiful now. It isn't being obscured by the descent and loss of fat. Cheekbones look higher because of that, better definition. The improvement along the nasolabial fold and in the jowl area is marked because this tissue has been released and moved backwards. And again, incisions look supernatural. The idea behind any kind of lifting or rejuvenation of the jawline is to restore a long, elegant jawline. Here we have a short jawline. It's short because the jowl's here. There's depth here where the tissue has fallen back and down, and it looks short because there's a lost mandibular angle definition. Here we've restored all that by releasing and moving the tissue back up to where it belongs. In the neck, same idea. Release all the way across and move it. Detach it from where it attaches here at the sternocleidomastoid muscle, this big muscle. Detach the muscle, the platysma muscle, undermine it, release it all the way around, all the way forward, and then move it. And she gets not just jawline improvement, the neck is improved, and the definition in front of the sternocleidomastoid is improved. And that's a very youthful look that can really only be, in my opinion, achieved with a deep plane release and movement. Profile view shows similar changes. Please note what a beautiful, you can't really find an incision here. It looks supernatural, and she looks very natural, just like she ought to. Here's a patient who lost a lot of weight. And with weight loss patients, very often we have to add fat. In her case, I did not. So this is a pure, deep plane face and neck lift with a complete release of her mid-face, around her jawline, and in the neck, with no fat added. And look at how much volume she naturally has that we just can move, even with all her weight loss. Smile lines, so much improved by moving that tissue back to where it belongs. The lift ends here, so the smile lines around the eyes are still there, and those have to be treated with Botox because there's no undermining and moving in this area with this surgery. But the entire mid-face and jawline looks so much better, and she looks so much more natural. Again, we see the improvement of the lines. We have a restoration of the beautiful long jawline that is really hard to get without releasing all the tissue and moving it. And again, incisions look nearly invisible. This is at 3 months after surgery. Looking down, all that redundancy has been moved without pulling. It's just releasing and moving. So she doesn't look pulled at all. She just looks supernatural. Now, could she have used fat transfer to improve some of this hollowing, improve some of the volume in her temples and other areas? Absolutely. But she didn't want it. We just did a pure deep plane facelift. I try to listen to what my patients want. Here, in fact, we see how much improvement you get in those smile lines around the mid-cheek area, all much improved. So now let's talk about preservation. So deep plane facelifting is something I've been doing forever, over 20 years. And it's been the technique, I think, has advanced significantly since I started doing it. I was doing things much differently before I started doing preservation lifting and from what I had been doing. And that was based on paying visits to colleagues around the country and making sure that I was doing what everyone who was the best at what they do were doing. And so I based my really, I think, pretty good results with great longevity. We really have not had to repeat this kind of facelift. The longevity is incredible when I've been doing this over 20 years and haven't had to do a repeat deep plane lift. The difference between deep plane and preservation, the preservation lift preserves attachments between skin and deeper structures to a greater extent than the deep plane lift. In the deep plane lift, we raise a little bit more skin in front of the ear before we enter the deep plane. With a preservation lift, we're entering the deep plane further back. So there's less skin alone that has to be elevated. Why is that important? Because blood flow to the skin is the main thing that slows down healing. If we impair blood flow, healing is slower, swelling is worse. So if we can preserve blood flow to the skin by preserving how the skin is attached to the deep tissue, then I think that the improvement is significant in terms of healing and in terms of how the areas heal around the incisions. In the past, I used to elevate the skin completely in the neck and then elevate again underneath the platysma. Now, the skin of the neck is really only elevated in the back part and then only in the central neck, if necessary. Suction drains are used still. We'll talk about those in a sec. But the release, the amount of deep plane release is the same between a deep plane lift and a preservation lift. So if you're seeing online some people are doing deep plane, some people are doing preservation. Both have excellent results. The difference is in the shorter term healing process, I think, but at the end of the day, the results are both superb. So I'll use this patient as an example. We already saw. We did a full deep plane lift on her with elevation of the skin where I've marked. If I were doing a preservation lift, the skin elevation would be less. The entrance point of the deep plane would be further back. And then in the neck, we would only be raising in the midline when needed. So there's preservation of blood flow to the skin to a greater extent in the neck. But you'll notice that the deep plane elevation where deep goes all the way forward in both cases and all the way across in both cases. Here's an example from a study recently published in Facial Plastic Surgery, where the deep plane, it shows pretty nicely where the deep plane is entered with a deep plane lift and a preservation lift. Preservation lift, the deep plane is entered a little bit further back, and there's this island of skin that's left attached to the neck, and only the skin elevated underneath the chin and in these areas of the preservation. In a regular deep plane lift, much more skin elevation, so a little bit more swelling, a little bit slower healing. This diagram shows after the lift is complete where the areas of elevation are. And with a regular lift, a bit more skin has been elevated. With a deep plane lift, much less remains elevated because we're moving the deep plane to occupy some of these spaces. So preservation deep plane lift with an upper and lower blepharoplasty. Excuse me for a second, I just need to. So upper and lower blepharoplasty and a peel around her eyes. So so this is a deep peel that I do for her because of the amount of wrinkling she had. But we see with a preservation lift, it's the same structural changes as the regular lift. It's just the healing process that's a little bit different, a little bit faster. We see improvement in the lines around her mouth as she smiles. We see volume in her upper mid face is improved. These transitions are better without gullies. And we'll see jawline in a second, how it is markedly improved. So moving the tissue back and up improves mid-face, improves cheek volume, jawline definition is improved, and neck definitions improved by this moving, repositioning, and then sewing. Incisions heal beautifully because there's no tension at all in the incision as we heal it. Profile view shows similar improvements. As she looks down, you see all the redundancy in the neck that's been improved by moving that deeper layer back and up. I thought it'd be interesting to see what patients look like as they're healing from a preservation lift. And I'm sorry I don't have a regular sort of deep plane lift to show you as to the same time frame, but here's before surgery on the left, here's at 1 week, and here's 3 months after. And now this was a preservation deep plane facelift with a deep peel around her mouth because of the various lines we wanted to improve. Remember, a lift ends, the improvement ends at the nasolabial and marionette lines. Inside of that, there's no improvement. So a peel helps to tighten skin and improve some of the irregularities that you have there. She had nothing done to her eyes other than nothing. She had nothing done to her eyes. The difference between this picture and that picture is swelling and some Botox. So mid-face volume is improved at 3 months. At 1 week, she looks kind of weird. She doesn't really look like herself. She looks pulled. She looks unnatural. That's at 1 week. And this is the healing peel at a week, looks red. But we see the hallmarks of improvement. Mid-face volume is improved. That maintains itself as we continue the healing process. And the improvement around the mouth area is significant. Mid-cheek lines are much improved. By 3 months, most of that swelling is out. Now, she's still a little red around the incisions at 3 months. And the other thing that you see that at 1 week, she has a fair amount of fullness underneath her chin, and that's starting to recede at 3 months. It takes a year for the jawline definition to complete because of that because it takes a year for all that deep swelling to go out of that deeper structure in the neck. But these little spots are spot peels I did for her brown spots. It's interesting, this brown spot was peeled and then lifted, and it moves all the way back to here. So you get a sense of how much tissue motion there is. Again, she looks kind of weird and pulled, and that all settles out by certainly by 3 months. Typically by about a month, people are going out and not having any concerns at all about how they look, sometimes earlier depending on their age. Again, that sweeping jawline is improved just like every other lift that I've shown you, and definition in her neck is much improved in front of the sternocleidomastoid, which I think is a hallmark of a beautiful youthful neck. Things are just healing beautifully. Her earlobe looks better than it did pre-op, not as pulled down, even though we did a lip. And you see the improvement in the smile lines that maintains itself, and will continue to improve, by the way, as that deeper swelling goes away. On the other side, so we're fully transparent. Again, a peeled spot here and peel around the mouth. Preservation, deep plane face and neck lift, improved jawline, volume in the midface, jowls, everything. I think, these are transcendent type of improvements that leave patients looking like themselves, just a lot healthier. So some common questions. How long does this surgery take? Well, it takes 6 hours. What kind of anesthesia do we use? So typically, we're operating for these cases in my in-office operating room, which is fully accredited by the Joint Commission as a outpatient surgery center, or an office-based surgery center, I apologize. So Joint Commission is the highest standard of accreditation, I believe. All the hospitals use it, and we wanted to be as high in our standards as we can. IV sedation by me or by my nurses at my direction is given. So it's not a general anesthetic. You're sleeping, but really unaware of what's happening. I think it gives a faster recovery with less bleeding and bruising during the surgery. You will be asleep. You won't have any unpleasant memories of anything, but you don't need to be intubated. You don't need to have a breathing tube placed. So the limit is 8 to 10 hours for this surgery for me. So if we have surgery that's longer than 8 hours, we have a discussion about whether it's better to go with general anesthesia. Why would a surgery be longer than 8 hours? Well, let's say we're doing brow lift, upper bluff, lower bluff, and a facelift. That is now about a 9-hour surgery. And so in those cases, we might want to think about general anesthesia for that. Wow, I'm scared I'll feel pain. Well, certainly during surgery, you don't feel anything, you don't remember anything. And after surgery, we really encourage patients to avoid narcotic use. We give you other medications. Celebrex is one that all our patients use, which is a non-steroidal anti-inflammatory like an ibuprofen that doesn't cause bleeding. And it's really excellent for postoperative pain management. Tylenol can supplement that. We give a narcotic prescription if you need it. Most patients don't need it after the first night or two. Pain is always worse at night, and many patients might take a narcotic for the first night or two, but after that, very unusual to need a lot of narcotic. How can I heal faster? Well, preservation deep plane facelift will allow you to heal a little faster than the older style deep plane facelifts, but nonetheless, even more improvement in healing. We go through a lot of strategies in your preoperative visit, including diet recommendations, what products to use before and after surgery to help with the healing process, what to do, lymphatic massage, post-op, that sort of thing. Hyperbaric oxygen is something a lot of people are talking about. We use it when patients want it. I can prescribe that for you, but I don't really feel like it helps very much. With the preservation lift now being done pretty much by me for everyone, the need for hyperbaric oxygen to help with the healing process, we really haven't had it very significantly. How long do the results last? Well, we talked about we're moving the tissue by 15, 20 years, so we think that the results can last that long. Do I use drains? Yes, I use drains. Drains are for seroma, to prevent seromas. These are collections of fluid in the area where skin only is elevated. Because of the preservation lift, we're elevating less skin. The drains can be taken out earlier. So they stay in for 2 or 3 days usually. But they stay in for as long as they need to stay in. And your body kind of tells us when they're ready to come out because they're not collecting anything. Drains are a nuisance, but they're really important. They really, I think, reduce the risk of irregularities and swelling, and eliminate the incidence of seroma in my practice. So typically the timetable is day one. You have an overnight wrap that's big and bulky that we remove the day after surgery. We'll give you a smaller wrap days 3 or 4 when drains come out, sometimes day 2, depending on how much they put out. Day 7, sutures are out in pretty much everyone, and then we recommend lymphatic massage that can help with the swelling, come out faster. By 2 or 3 weeks, you can get more active. We give you a wrap that you can wear only at night depending on the patient, sometimes after a week, sometimes after 2 weeks. After 2 or 3 weeks, patients can get back to more limited work, but the contraction phase of healing begins. Everyone goes through very predictable phases of healing. The first 2 weeks are inflammation, where the body is sending cells in to help heal. But contraction is when the collagen and elastin that's being laid down is actually starting to contract. And that's important because that's when things get lumpy, bumpy, or irregular. And everyone goes through a lumpy, bumpy, irregular phase, no matter what surgery you've had. If you've ever had surgery, you know this is true, and it lasts for several months until it all smoothens out. So contraction can be helped by massage, by lymphatic massage, by your own massage, and we often will recommend something called a beauty bar, which is a vibrating instrument that helps with that. At 3 or 4 weeks, you're good enough to go out for lunch with dinner or dinner with your friends. You can take pictures without feeling self-conscious. 2 months, you really need to wait a couple months before you're ready for a vacation or real headshots and that sort of thing. Public speaking, often before 2 months, people are self-conscious. There's always numbness around the ears. That's from raising the skin in that area, and that starts to go away by 2 months. And everyone's doing a full core exercise by 2 months. Usually by a month, you can start to be more vigorous in terms of your exercise. And then at 6 months, numbness, firmness, only in small areas around the ears and central neck, if we've elevated the skin there. It's really only in the areas that we've elevated skin by then. It takes a full year to heal, and I think patients, on the most part, are really happy. If there's a little touch-up that has to be done because something that doesn't look quite right, that we can do at a year. So now I'm going to have Devin come in. Devin is our cosmetic consultant, and you'll all be getting an email from Devin following up with you to see if you'd like to take any steps forward. You can certainly schedule a complimentary consultation with Devin by replying to that email, or by scheduling online with her, or by emailing her directly at that email on the screen, devinw@westlakedermatology.com. You can also schedule a consultation with me by calling the Lamar Central office or visiting our website. And then for this webinar, we have a $1,000 off offer. You can take advantage of that by replying to Devin's email. She'll send you a quote, and as long as you schedule your surgery for a later date by July 31st, we'll honor that $1,000 off. We really look forward to seeing you all soon, and I also look forward to some questions that we have. So
yeah, I had quite a few that came through, so I'll go ahead and start on those. I do have a couple pertaining to the first patient that you had showed. The first question was, were all of her procedures done at the same time? And if not, how long in between each procedure, and what order do you prefer?
Great. So let me, you know what? Let me just bring that patient back up again real quick so we can answer that in a way that makes sense.
And then let me go ahead and ask you the second one too, because it's also about that patient. Does she have a chin implant?
Okay, so just to remind everyone, we had a deep plane facelift, endoscopic brow lift, upper and lower blepharoplasty, and a periorbital peel, and all of her surgery was done at the same time. We did not stage this. So it was a long operation. She did great with it, and we did not do it under general anesthesia. We just did it under IV sedation anesthesia as we normally would. So, but it's really at because of the lengthy how long the surgery took. She was someone that we had a pretty serious discussion about. Well, is it worth? Do you think you'll be able to withstand that kind of length of surgery? And the things that might bear is if you have any neck or back issues, then it may not be a great idea to have such a long surgery. But under general anesthesia, because the body is more relaxed, it's better tolerated. But she had it under IV sedation anesthesia. Let's see if I can pull up the. Okay, so the question about a chin implant. No, she did not have a chin implant. All the changes that you see around the chin area have to do with elevating and moving those deeper structures in the upper neck and jowl area. And it creates a longer jawline that makes the chin look better. The transition looks better. Here she looks like she has a little bit of a droopy almost witch's chin, and that is not been changed with an implant or any other filler. That is just the effect of her surgery. All right, Devin, what's next?
All right, next question. How long do the effects last, and how do the scars look 5, 10, 15 years later?
Yeah, so um, I think we've answered the how long does it last? It lasts in most patients, it lasts for about 15 years because that's about where we're putting the tissues back to. But it's not that it suddenly gives way at 15 years. You're you're starting from a better place and then you age. And so 15 years after surgery, say you're 40, say you're 50, and you have the surgery at 65, you're going to look like you might have looked at 50, which isn't too bad, right? But if the time to look critically after that is yes, if you feel like there's something that's fallen a little bit more than you'd like, and you would like that touched up, that would be something that could be done. However, like I said, in my practice, I haven't seen it. Patients really are very happy for as long as I know them. Um, what was the other part of the question, Devin?
How
Oh,
do
how
the
do the
scars?
scars look?
Mhm.
Sorry. So the scars are really not visible. They don't widen. They don't they don't do all the things that you've seen in Friends or online about with scars and facelifts. The scars are hard to find at 3 months. They're hard to find at 3 months. They're just the little red line that redness still hasn't faded completely. Most people don't see them because they're in the shadows of the face. They continue to heal well, and they are not significant as scars down the line in most patients. In a rare patient, when we were doing the uh, other type of facelift and when we were using some medications that seemed to interfere with blood flow, which we didn't know at the time, those patients would have slower healing in some of the areas of incision behind their ears, for example, and those scars eventually looked good, but they don't worsen Occasionally, we'd had to touch up that scar because of poor blood flow to the area. Now with preservation lift, really have not seen that.
Perfect. I think you might have answered this one also, but how long does the pain last after the procedure and what are the potential issues?
Yeah, so I mean, so pain is very personal. It's rare to it's rare to have a patient that has significant pain after the second or third day because pain peaks at 48 to 72 hours after any surgery. It's not, it's more of a soreness that's a dull ache that you can't get rid of, and that's what the pain medication helps with. Um, Potential issues, that's a pretty broad question, but the risks of any facelift, and this is including anything that I'm doing, the risks are things like cutting a nerve that would cause a paralysis of one side of the face or inability to feel the ear or inability to raise an eyebrow. We've never had that complication in my practice ever after 30 years of doing this. Um, so that would be quite unusual. Seromas were a complication before I started using drains. Now we don't see them. Poor blood flow to the area, really haven't seen those with these newer techniques. And hematoma, collection of blood, is a complication after any surgery. The, uh, the literature says that there's a 5% risk of hematoma after facelift. I haven't seen a hematoma after a facelift in 20 years. So I think whatever we're doing, we're able to avoid most of these risks.
Perfect. Have you ever met a patient that you feel would benefit from a SMAS over a deep plane lift?
No, there's no just the smash lifts are very limited, and even a young patient who's seeing some laxity by pulling on the smash, it's going to help her feel better for about a year or two, and then it's going to all come back. No, deep plane lift is the way to get longevity, a predictably uh, beautiful result that doesn't look done, doesn't look pulled, looks just supernatural. I don't recommend smash lifts for anyone.
Perfect. Were all of the before and after photos shown performed by you?
Yes, that's a
Perfect.
weird question. Yeah.
Well,
All the before and after photos were performed by me. The only picture in this whole presentation that wasn't a surgery performed by me was that from that journal article that showed the various shaded areas of where skin is elevated. But yeah, all the surgery is by me.
perfect. How long have you been doing the preservation specifically?
2 years.
Okay, perfect. This one I believe you also kind of touched
Can
on,
I
but
just say
when
something about that? Sorry, I'm
of course.
sorry. My transition to preservation facelift preceded preservation facelift being reported. What does that mean? Well, so I was doing a deep plane lift where it was more of a standard entrance point, which is further forward, so raising skin more and then raising all the skin across the neck. But the preservation lift, one of the big hallmarks is moving the skin elevation in the cheek back so that better blood flow is improved, is retained. And that means a more posterior, closer to the ear entrance point to the deep plane. I started doing that probably 5 or 6 years ago. In the neck, I was raising all the skin until about 2 years ago when I stopped doing that after visiting some of my colleagues around the country and seeing what they were doing. And I've been really happy with that change because I think the blood flow to the neck skin is so much better that irregularities we used to see in the neck because just from raising the skin and then laying it back down over a structure that's been lifted, those irregularities are much less common now.
Perfect. How long before you can get back to walking, Pilates, exercising with weights?
Yeah. So walking is usually, it depends on how much swelling you have. So everyone swells a little bit different. Some swell more, some swell less. If you have heavier features, you'll probably swell more. If you're thinner, you'll probably swell less because the tissues can't hold as much anyway. Um, so walking, we usually say about 2 weeks. You can start getting out and doing some more vigorous walking. But with any change, you'll just pay attention to what's happening. If you start to get more active and you're getting more swelling, you're done, just pay attention to your face. It's telling you you're doing too much, so back off. Core exercise, Pilates, where you're putting stress on your core. Remember, we're moving the muscles in the neck, and they have to heal now. It takes about a month before you can really start to stress your core.
Perfect. Have you ever performed the surgery on any patients with autoimmune diseases, specifically on monthly infusions of biologics?
Yes. So, being at NYU at an academic center, we used to see patients with many different types of systemic diseases. And there are very few diseases that prohibit this kind of surgery. There are some. There are some that would make this surgery risky. But I would probably recommend that you and I have a direct discussion about what it is that you do and what kind of biologics you're on. Typically, it's prudent for me to have a discussion with your rheumatologist regarding the impact of any surgery on your condition before proceeding.
Perfect. Does having Sculptra affect the procedure?
There's a lot of negativity about Sculptra online now, and I think it's for good reason. Sculptra, for people that don't know, is a particle. It's not a filler that gets injected. It's a particle that gets injected, and then your body forms collagen around the particle, and that's how you get volume, how you get fill. So it creates an inflammatory response by the body. That means that it's like creating a limited scar. And so if you have a lot of Sculptra, it means it's harder for me to get through that tissue to get it released and lifted. It doesn't mean that it can't be done, but we can expect a little bit of a longer surgery to be safe and a little bit more swelling afterwards because we're basically operating through scar. Some of my colleagues say never get Sculptra. I don't think that's realistic in this day and age. Sculptra has good properties that people really like. But I've done many surgeries on patients who've had all kinds of fillers, and Sculptra is not one of the ones that I have had huge problems with.
Perfect. I'm not exactly sure what the next question's asking, but they say, how about to eliminate acne scars? I'm not sure if that's from the facelift or.
Yeah. So I mean, I think the question might be, if you have acne scars and you have laxity, then will lifting or pulling on this, if you pull on the skin and you have acne scars, it'll flatten the skin. We're not really pulling on the skin. We're moving that skin all the way back, but we are improving the structural support of the skin. So it will not eliminate acne scars, for sure not, because that's a skin problem. If it's a skin problem, the skin has to be addressed. So lasers or undermining the scar and putting something underneath it. But broad depressions also, we're lifting that area and it will change the depression. But typically in patients like that, we might think about doing some fat or nanofat injections at the time to improve some of the volume problems the scars created.
Perfect. Do you trim or reduce the submandibular glands?
Absolutely. In fact, submandibular glands are a real problem in patients after facelift because so some of my colleagues around the country believe that creating a sling of the muscle and lifting it up will push the submandibular gland that's saggy up and make it become less of a problem. The problem is that gland is really encased in deeper tissue, and moving the tissue up above it to push it in doesn't really work very well. So I do reduce, I don't remove completely because that would be, I think, dangerous in a facelift, but I do reduce a portion of the submandibular gland when needed, and it seems to improve things a little bit. Um, I think uh, I can think of one patient I've recently operated upon, recently a couple years ago, who has had a great result but had prominent submandibular glands still, and so we're planning on going back and trimming those in a surgery in the near future. But now I make a point of looking for that and trying to treat it at the time of the surgery so I don't overlook it.
Perfect. Is the nose tweaked or can it be refined at the same time?
No. Rhinoplasty, well, first of all, rhinoplasty in my hands requires general anesthetic. Um, and if rhinoplasties take 3 hours for me, I do a structural rhinoplasty that is extremely complete, so that again longevity is a lifetime. Um, I'd prefer not to do rhinoplasty at the same time as facelift, just because it now becomes a 9 to 10 hour surgery, and it's a hard thing to do. Patients who have had rhinoplasty at the time of facelifting are usually having a different type of facelift that doesn't take as long, which I don't do, or a different kind of rhinoplasty that doesn't take as long, which I don't do. I prefer to treat these areas completely so we get great results and patients are happy without need for revisions or complications.
Great. What's your opinion on the use of transient sutures or hemostatic mesh?
Oh, that's a great question. I used hemostatic mesh, which is basically what the question is referring to is in areas where the skin only is raised, there's a potential space, a dead space underneath. Now, I drain that space in all the spaces that I lift the skin in, I drain with drains. Now, surgeons that use a lot of hemostatic mesh don't use drains. I really like, and what a hemostatic mesh is stitches that are placed all the way through the skin to the deeper tissue and then out again and tied to flatten the dead space so there's no space underneath the skin. Um, I prefer a drain. I think it works better. Hemostatic mesh I use, but typically only in the upper midface where the drain doesn't go. And so in those areas, I'll use a hemostatic mesh that those stitches come out at the same time as the drains, typically at 2 or 3 days.
Perfect.
Yes,
Do we have,
use it when I need to, for sure.
do we have a post-procedure recovery center?
I wish we did. There's none in Austin, so sorry. We do provide nursing if you're coming from somewhere outside of Austin. Stay in a hotel nearby, and if you don't have a loved one that wants to take care of you, or you'd rather have a nurse with you, we have nursing services that will do that for you. But there is no recovery center in Austin.
Perfect. Is it important to be at a stable weight when having the procedure done? What happens if you lose 20 to 30 pounds after the procedure?
Yeah, that's a great question. Yes, I think it's best to have your weight loss complete before facelifting. Although theoretically, if we're releasing and moving these tissues and then you lose weight, everything kind of sets in fine. But in practicality, what happens with weight loss is the SMAS layer thins, as well as the fat between the SMAS and the skin, so you get some sagging of the skin or some wrinkling of the skin back. So it's best, I think, if you're stable, to move that whole structure back after you're basically stable in your weight. BMI is an important issue with us. We do not recommend facelift surgery in patients with a BMI of 33 or greater, or I should say greater than 33. If you're right at 33, I'll encourage you to try to lose a few pounds so you get down below 32. Below 32 is best. And there's no lower limit of BMI. You can have a BMI of 17 and have a great result. In very low BMI patients, though, we often will talk about fat transfer at the same time to replenish the support in the deep face in the areas deeper than what the lift is doing.
Great. Is it possible to do a deep plane face and neck lift on a patient who's previously had threads?
Yeah, it depends on the threads. If they're temporary threads, it's not a problem. If they're more permanent threads, um, we often will see the threads and remove them if it's safe. I have had the unfortunate experience of having someone with a permanent thread where I took it out and they had weakness. This was a brow lift thread, raising the eyebrow. I saw it while I was doing her brow lift. I took it out, and it must have been very close to the nerve that allowed you to move your brow. And so she had weakness temporarily on that side of the forehead for 6 months. I was really nervous for her. So my real opinion about threads is never have a permanent thread placed. Temporary threads have their role. A lot of people use them. They create a little bit more scarring, but once they're dissolved, there's no problem.
Great. And then can a lower blepharoplasty be done at the same time as a facelift?
Yes, we often will
Beautiful.
do that. Yeah.
And then I believe this question was probably pertaining to that first patient also, but they were asking what a quad blepharoplasty was.
Oh, a quad, sorry. Quad, it just means upper and lower bilaterally. So it's four. Quad means four, so upper lids two, lower lids two, quad bleph.
Perfect. Well, that was the end of all of the amazing questions that I've received on my end.
Well, that's
They're
great. Now,
staying
I'll just
posted.
I'll just let you all know if you want to sort of go back and review some of the stuff we've talked about. We will be posting this webinar on the Westlake Dermatology YouTube channel. On that channel also are some webinars that I've done previously. An earlier version of this webinar is there, plus a blepharoplasty webinar, which I think is really helpful for anyone who's thinking about eyes. And we'll have a rhinoplasty webinar there too for anyone who's interested in that. So thank you all for attending. That's awesome.
All right. Bye.